Hello everyone for joining this webinar on provider registration. My name is Liz Hefren-Webb and I'm the Aged Care Quality and Safety Commissioner and I'm chairing today's webinar. I first want to acknowledge the traditional owners of land on which we meet today and pay my respects to elders past, present and emerging. And I extend that respect and acknowledgement to Aboriginal and Torres Strait Islander peoples watching today. I'm joining from Renewal country. Joining me on the panel today is Robert Day, Assistant Secretary of the Harmonisation and Regulatory Strategy Branch at the Department of Health and Aged Care. And from the Commission, we have Sarah Kelly, who's the Acting Registrar in Regulatory Operations, and Christian Hess, who's the Acting Executive Director, Quality Assessments and Monitoring Group. Before I start the discussion, I'll do a quick bit of housekeeping. After we hear from our speakers today, we'll move to a Q&A session, and you can ask questions at any time. Just use the question box via the live Q&A tab, which should be visible on your screen. We also have a short survey for you to complete at the end of today's webinar to provide us with feedback on today's event. Just stay online and a survey will pop up on screen. It's only short and your feedback is important to us, both in determining future topics, but also to understand the value of the topics we'll be discussing today. Today's webinar will be recorded and published on our website in the next couple of days. Everyone who registered for today's session will be sent a link to the recording as soon as it's available. Today we're going to talk about provider registration and renewal in practice. We will start with information from Rob Day about how the deeming process will work. Sarah Kelly and Christian Hess will then take you through the step-by-step process of registering as a new provider and renewing registration for existing providers, including audits and how providers can vary their registration. We will also touch on registration forms that will be available on the Commission's website and on cost recovery. I'm really pleased with the strong turnout we have today, and I encourage you to share your thoughts, comments, and questions through the live Q&A tab. We've had lots of questions already submitted, and we will try to get to as many of these as we can. So let's get started, and I'm pleased to now invite Robert Day to kick off our discussion. Thanks, Robert.
Thanks very much, Liz. Hi, everyone. Really great to be part of the conversation today. I thought I'd start with a quick update on where we're at with the transition to the new aged care regulatory model, including an overview of some of the key registration changes that you can expect. You might remember that the foundation of the new the regulatory model and the new rights-based Aged Care Act are the findings of the Royal Commission into Aged Care Quality and Safety. And these recommendations outline that reform in aged care will improve the quality and safety of aged care services for older people with a focus on person-centred and rights-based care. Under the new Act, providers will be registered and regulated at the provider level rather than at the residential aged care home or service level, as is currently the case. This reflects the fact that often provider-level decisions and policies will impact on the quality of services at an individual service level. This change also makes it really clear that the executive and governing body of a provider are accountable for the delivery of care in all of their locations. Some of the other key registration changes to be introduced by the new regulation model are universal provider registration. So that's a single registration across all of the services that an organisation delivers. Another change is time-limited registration. So there's going to be a regular process of checking in on providers approved to deliver aged care services. Usually this registration will be for 3 years, but the Commission will have the discretion to set either a longer or a shorter period. And registration categories are also an important change, which will ensure that the process for registration and renewal, as well as provider obligations, are proportionate to the type of service that's being delivered. Providers under the new Act will need to register in one or more registration categories based on the types of services they intend to deliver. As you can see in this table, the provider registration category will determine which obligations and conditions a provider must comply with. The registration categories will also determine the process for registering to become an aged care provider or to renew registration. In particular, you'll see on this slide that an audit against the quality standards will be a requirement for providers seeking to register or renew in categories 4, 5 and 6. These audits will take place at each aged care home and also for any services delivered in the home or community at a whole of provider level. My colleagues from the Commission will talk some more about this, but it's worth calling out that these audits will test conformance against the aged care quality standards. So that's a forward-looking test at whether the organisation is set up to deliver and constantly deliver care consistent with the quality standards. This forward-looking focus is intended to support continuous improvement in aged care services and will be different to the monitoring and the enforcement powers the Commission might use when it's identified a provider who might not be complying with some of its obligations. With universal provider registration, providers will have a single registration across all of the services they deliver in multiple programs. And this will be irrespective of whether that care is in one registration category or multiple registration categories. Introducing universal provider registration also means providers who deliver services across multiple registration categories or programs will have one clear set of consolidated obligations rather than having different obligations attached to individual programs. In transitioning to the new Act and this new universal provider registration, we're going to use the ABN as a key to identify organisations that have multiple records across different service types, and these will be combined into a single registered provider from the 1st of July. Organisations that are currently operating with multiple ABNs will be deemed into the new Act as multiple registered providers, but you will have the option to consolidate those into a single entity under a single ABN. You'll just need to go through the usual processes of combining services or moving services between organisations to achieve that outcome. We think there are some useful reasons why you might want to think about having that consolidated registration, and this includes having just a single approach to renewing registration rather than having to do that once for each registered provider entity. The cost of audits and other relevant costs will again be consolidated to the provider level rather than for each individual entity. And obligations and reporting and notification obligations will also be consolidated if you bring multiple entities together as one. An easy way that you'll be able to tell whether we've got you recorded as multiple entities or one is that you will receive multiple provider registration previews if we've seen that you are set up as multiple organisations in the current system. And I'll talk to you a little bit more about that provider registration preview in just a moment. So let's talk about what deeming is. Deeming is the legal process of translating providers from their current status under the Aged Care Act 1997 to the new status on the 1st of July 2025 under the Aged Care Act 2024. But to get registration right, we're going through, and deeming right, we're going through a step-by-step process so that we can make sure we're as accurate as possible on day one and that providers can continue to deliver services under the new Act. The current stage of this process, which we began on the 1st of April, is the provider registration process, and that's the second last stage in the deeming process. Most providers will have received their preview information as a PDF attachment from a no-reply departmental email. There's some providers, about a third of providers, who didn't complete last year's deeming validation survey for one reason or another. And because we're dealing with protected information, we're asking those providers to first complete a declaration and consent form before you can receive the preview PDF. So those organisations who need to complete the consent process will have received an email on the 2nd of April this year with the subject line, "For action, complete declaration form to receive proposed registration information and registration categories." If you get one of these emails, we're asking you to complete the declaration form as soon as possible so that we can then release the preview document to you with as much time as possible for you to go through that document. I'll now take a little bit of time to talk you through the preview itself and what to expect. As part of the registration preview PDF, you'll receive instructions on how to update your information, what can be updated, and how to reach out if you need support. The registration preview PDF has grouped all of the information that will be used for your registration under the following headings: your registered provider details, your registration and service delivery, the registration categories that we propose to deem you into, any associated providers, that's contractors that we have recorded as having a relationship with your organisation, any funding, if you're funded through one of our specialist aged care programs, one of our grant-funded programs, service delivery branches, and approved residential aged care homes that we have on record as attached to your provider. We ask you that you review the content carefully to ensure the information reflects the services that you are currently providing. It'll be a good idea to share the preview with other members of your team for confirmation, such as operational and financial colleagues, to make sure that all the relevant information is included. If the preview information is correct, then you don't need to do anything. If there's something wrong, we're asking you that you let us know by 5 p.m. on the 1st of June this year. And you can follow the instructions in the preview if you need to make updates to particular information or if you need to reach out for support. We've also released a short video on the registration preview, which is now available on the department's website, and I'll talk you through over about 5 minutes the preview process in some more detail. As you can see on this slide, the preview is being released in stages, depending on whether you need a declaration form or whether we already had your consent and can send you the full PDF. But with the exception of about 50 providers, every provider should have received an email from us on either the 1st or the 2nd of April. The review process has started, and you have until 5 p.m. on the 1st of June to update your details. Between the 2nd and the 30th of June, we're going to need to lock down provider data so that we can do what we need to do to get ready for that deeming transition on the 1st of July. And then on the 1st of July, both legally and in the government provider management system, we will make that transition for all providers ready for the commencement of the new Act. There's plenty more information available. Keep your eye out for some soon to be released further videos on the new regulatory model. And on this slide, you can also see both a website that will give you more information and an email address that you can contact if you've got any questions. So that's it for my update. I'm going to hand over now to Sarah Kelly. Thanks, Sarah.
Thanks, Rob. I know we've had a lot of questions about the deeming arrangements, so I really hope that people find that useful. And if you do have any further questions, just pop them in as well, and we'll try and cover them at the end. It's really lovely to be here with you today. My name is Sarah Kelly, and I'm the Acting Registrar for the Commission. So continuing with the theme of the webinar today, I'm going to be talking with you about the registration and renewal processes in practice. So again, we've been guided by the pre-questions that you've sent through in preparing the content for today, and the aim is to keep it as practical as possible. So we're going to work our way through the following topics: the registration and renewal process, including how you can vary your registration, the way you'll provide information when you want to register, renew or vary your registration. So that's where we talk about the forms that you'll need to fill in and submit, the process of having a renewal audit, and my colleague Christian Hess will be taking you through that material, and then also the possible or proposed costs for registration. So let's just have a quick recap on the registration model itself. And for those of you that attended the webinar last month, we did cover this through that session as well. So under the new Aged Care Act, all providers of funded aged care services will need to be registered by the Commission. And so this is different to current processes where only some providers are approved by the Commission. To become a registered provider, an organisation or person must apply and be registered by the Commission in one or more provider registration category. The categories are based on the types of services that the provider plans to deliver. In the provider's registration and renewal process, we will test the provider's suitability, capacity and capability. If we decide to register the organisation or person as a registered provider, it will be for a set period. So registered providers will have obligations and conditions of registration that they must comply with to stay registered. We can also add condition to a provider's registration. Some conditions will apply to all registered providers, and other conditions will be specific to a category or will be specific only to an individual provider if the Commission has imposed them. We'll also give a supervision status to all registered providers. And we do risk-based monitoring by using this supervision model. The Commission may also change the registration of a provider because of risks to older people that they're caring for, providing services to. The registered provider can also ask the Commission to change, suspend or revoke their registration, and we'll cover that in a little bit more time as well. Registered providers will need to regularly apply to renew their registration, and that will restart the cycle of registration again. So whilst I appreciate that many of you are existing providers, let's have a closer look at the initial registration process, noting that the tests for registration and renewal are the same. So to apply for initial registration, an organisation or person will complete an application for registration form. This will be on our website, and we'll cover this a bit more in a little while. Applicants will need to give us information and evidence so that we can assess and determine if they're suitable to deliver funded aged care services. We'll have guidance on our website to help with this process, and this will include an evidence framework to help guide people on the kinds of information that we'll need to see. Organisations and people applying for registration need to show that they meet the registration requirements. This includes general requirements as well as registration requirements specific to each category they are applying to be registered in. When applying for registration or renewal, an organisation or person must tell us about each type of service they plan to deliver. This informs our assessment and our regulatory oversight. If they're registered as a provider, they can deliver all or some of the types of services in each category they're registered in. Registered providers need to let us know through a change in circumstance notification if there are changes to those service types. So if you're adding more or stopping delivering some. We will always provide procedural fairness when we're considering making an adverse decision, such as refusing registration, and we would let people know why we're thinking about refusing it so that people have a chance to respond and provide information to us. If we decide to register them as a registered provider, we set the categories that they're registered in and the registration period. And we can also decide to add a condition to the registration. For example, if a provider is registered in category 6 and opening a new approved residential care home, we may add a condition requiring them to report to us on a regular basis about their operational plan. They would need to tell us when they started delivering care and to how many older people. Right, we're going to move now and talk a little about the registration requirements. So this includes general requirements. So these are having an Australian business number, and Rob was just talking a little bit about that earlier. It also includes the suitability of the organisation or person, as well as suitability of each of their responsible persons. It includes having a record of and systems for financial management and meeting all the registration category specific requirements for at least one registration category. So we cannot register an organisation or a person if they do not meet these general requirements. So this means we might decide to refuse a registration application without looking at the registration category specific requirements, and that may mean that happens prior to an audit. The organisation or person must meet all the registration category specific requirements to be registered in that category. If they're applying for registration in more than one category, we look at the specific requirements for each category they're applying for. So the category specific requirements include an intention to deliver the service types they've nominated for 3 years after the application, commitment, capability and capacity to deliver those services, and if they're wanting to register into categories 4, 5 or 6 and audit against the quality standards that are relevant. To be registered in category 6, the organisation or person must also meet the approval requirements for at least one residential care home. And you can apply for approval of residential care homes as part of the registration process. We will not register an organisation or person in a category if they don't meet the category specific requirements for that category. So when registering providers, as I've just mentioned, we test suitability, capacity and capability. So I just want to unpack for a moment in a little bit more detail about what that means. So when we look at suitability, we're looking to see that providers and their responsible persons are fit and proper to deliver aged care services, that they demonstrate integrity and compliance with relevant standards. We look at capability. Providers must have the necessary governance structures, systems and processes to deliver safe and quality care. We look at financial viability. So providers must be financially sustainable to ensure continuous service delivery. And we look at compliance history. So we'll consider a provider's track record in delivering aged care or other relevant services, including any previous compliance action. Specifically, when testing the suitability of the organisation or person, we look to see if the organisation or person has experience in delivering aged care or similar services and their performance in that. We look to see that they have complied with laws of the Commonwealth or state or territory where they have business activities, whether or not they have in the past or currently a banning order or a National Disability Insurance Scheme banning order against them. If they're a registered provider, an approved provider or a registered NDIS provider and the registration had been revoked unless it was voluntarily sought for by the organisation themselves. And if they're a registered provider or a registered NDIS provider and that registration is suspended. We'll also check the legal and business structure. We want to understand the relationship between the organisation and any associated providers. So associated providers do work for registered providers, such as a subcontractor. The registered provider is responsible for making sure associated providers meet their obligations and will likely want to see some evidence of that. We also check financial information, which can include tax documents, balance sheets, and profit or loss statements. So Christian is going to speak a bit more about the process of audit, and Rob has also mentioned this, but I just want to take a moment to talk about the changed role of audit under the new Act. So it's shifted significantly to what we're all currently used to and is now linked to those registration category specific requirements. It's only carried out now as part of the registration process and it informs the registration decision. So the purpose of an audit is to assess whether the organisation, person or provider can conform with the relevant quality standards if registered. So audits are predictive, ensuring providers can meet legislative requirements before being granted registration. Audits are announced and the audit approach will have provider level evidence collected once only and then analysed, interpreted and applied to improve efficiency. Audit is not an assessment of current compliance. Just a note too on circumstances where providers might not be audited by the Commission. So an organisation planning to deliver specialist aged care through the Multi-Purpose Services Program or MPS program may not need to have an audit if they've had a health service standards assessment in the 3 years prior to registration, renewal or variation, and the audit found that they complied with the applicable accreditation scheme requirements for the National Safety and Quality Health Service Standards and the Integrated Aged Care Model. Let's talk a little bit now about approval of residential care homes. So for us to approve a residential care home, the home must meet the approval requirements and the provider must be registered in Category 6. Organisations can apply to the Commission for approval of a home as part of the registration process, but we will not approve the home unless the provider is registered in Category 6. A registered provider can also apply for approval of a new home at any time during its registration. To be approved, the residential care home must meet the definition of a residential care home. And I appreciate that sounds a little bit silly, but the definition is included in Section 10 of the Aged Care Act, and you can also see it on the slide that's on screen now. So the home must be fitted, furnished and staffed for the purpose of providing residential care. The building or buildings must be permanent, be suitable to be used as a home, meet all related building codes, standards and laws, and not go over the maximum occupancy. So if the Commission approves the home, we will decide the total number of beds covered by the approval. Approval of a residential care home is not the same as the current state accreditation, and it's a new function for the Commission. So approved residential care homes do not need to be reapproved as part of the registration renewal process or if the home gets transferred to another registered provider. So generally it would be a one-off activity. A registered provider can apply to the Commission to remove or add an approved home to their registration, and they can also apply to vary the total number of beds at an approved home or to revoke the approval of the home. The Commission can also vary the total number of beds in a home, and if a home is no longer suitable to be used for residential care, we may revoke approval. If an approved residential care home is no longer covered by the registration of a registered provider, its approval expires. If we decide to refuse, vary or revoke approval of a home, this is a reviewable decision and you can apply for reconsideration. The Commission will invite providers to apply to renew their registration prior to the expiry of their current registration period. And I know we've had quite a few questions about this process. So I'm going to sort of take you through it now over the next couple of slides. So what we'll do is invite providers and we'll ask them to tell us about their intention to renew. If they intend to renew in category 4 to 6, we'll then proceed with an audit. The provider then completes and submits an application for renewal. If a provider notifies the Commission of their intention to exit the aged care system or doesn't complete the application for renewal before the deadline, their registration will end. In these circumstances, we may place the provider under active or heightened supervision to ensure continuity of care for older people receiving services from the provider. So here's this sort of process mapped out on this slide. So we're showing you here the end-to-end process at the high level, and I'll just talk you through it briefly again. So firstly, it's the Commission who will start the registration renewal process by inviting a provider to renew their registration. So this will happen before the registration expires. So the invitation will outline the renewal timeframes, the information required, and whether an audit will be part of the process. Now that information may be given up to 18 months before the end of the registration period to take into account the work involved in auditing and considering the application. And so really that's predominantly about audits where we've got providers with a lot of residential care homes that need to be audited prior to renewal. So that timing will be influenced by factors like size, the current and proposed registration categories, and if they need audits, as I've just said. After receiving the invitation, the provider must either confirm the intention to renew or notify that they plan to cease delivering services. If an audit is going to be part of the renewal process, so that's for categories 4, 5 and 6, the Commission will then engage with you around the audit process and will issue an invoice for audits if indeed government decides to charge for the audit process as currently proposed. Christian's going to talk you through that process in a moment as well. The provider must lodge the renewal application within the application timeframe given by the Commission, and this will be set out in the invitation to renew. At a minimum, it will be 60 days before registration expiry, and the provider must continue to meet the registration requirements we discussed earlier. Sometimes there might be a time gap between the initial invitation and when the renewal application can be submitted, especially for large providers, and we'll come back and remind you of that time frame. We'll consider the outcome of any audit activity, plus any other information and intelligence we've gathered or received during a period of a provider's registration. So this might include routine reporting, notifications, information from complainants, and any outcomes of other risk-based monitoring or compliance activity. We may also come back to a provider for more information or to let them know there are some areas of concern as part of that process so that they can engage and respond on those. After the assessment, we might decide to renew registration, but with conditions, or we may decide to refuse to renew if we can see that the requirements are not met. When the Commission decides to renew the registration of a provider, they'll usually be registered for 3 years. This is unless we identify risk that means a shorter period of registration is needed to manage that risk. Once the Commission decides to renew registration, we set the categories the provider is registered in and the new registration period. And as I flagged before, We will follow procedural fairness in this decision, as with all our decisions, before deciding to refuse the renewal of registration. So we would follow a fair process, and that would include giving notice, a chance to respond, and carefully considering all information before making the final decision. If we decide to refuse to renew registration, we'll concurrently work with the provider to manage risks and ensure older people still receiving care are safe and that there are effective plans in place to transition people to a new provider. Any decision to refuse a provider's registration is reviewable, and a provider can apply for a reconsideration. So we appreciate that once they're operating, a provider might want to change the services they're delivering or the scale of their business. So a registered provider can ask the Commission to vary its registration. They can ask to register in a new registration category, remove a registration category, add or remove an approved residential care home from a registration, and that includes applying for approval of a new registration home or requesting revocation of one. They can also apply to vary or revoke a condition of registration that's been added by the Commission. And a registered provider can also ask the Commission to suspend or revoke its registration. And this would usually happen when a provider's voluntarily decided to close its business. So providers can make these requests in an approved form, and the form needs to include all the information. And if, again, this is currently also proposed to have a fee attached, so potentially with the appropriate fee, sorry. So the Commission will then consider the information in the request and decide whether it's appropriate to vary, suspend or revoke the registration. And when looking to make that decision, we look at what arrangements there are in place to make sure that people receiving care have continuity of care. We may add a new condition of registration to respond to a provider requested variation, and that would generally be to manage any potential risk. If a provider wants to extend their registration to a new registration category, we again consider the registration category specific requirements for each new category they're applying for. And if they're seeking registration in categories 4 to 6, it's likely that there would need to be an audit against the quality standards. And again, if we refuse that request, that again would be a reviewable decision and a provider can seek a reconsideration. The Commission can also change a provider's registration if appropriate or to respond to risks, for example, because of non-compliance. So the Commission can add a new condition, change or revoke a condition, remove a registration category, change the registration period, or remove an approved residential care home from registration. We can also suspend or revoke registration, although this would be an action of last resort because of the serious consequence for older people, aged care workers and the provider. If we suspend a provider's registration, Australian government funding would stop while the registration is suspended, and the provider still needs to comply with their obligations if registration is suspended. If we revoke a provider's registration, they'll no longer be able to provide funded aged care services. So I'm now going to hand you over to Christian to take you through the next part of the presentation on the renewal audit process.
Wonderful. Thanks so much, Sarah, and good afternoon all. I'll be taking you through the 3 stages of the registration renewal program for providers and discuss how audit process works and what you can expect along the way. So this next slide I have for you kind of outlines the 3 stages of the audit methodology for registration renewal audits. Stage 1 is the audit initiation. The purpose of audit initiation is to commence the audit program with the provider and support the provider to prepare for the audit through clear communications, provision of information, and requests of evidence. Stage 2 is the audit delivery, and the purpose of audit delivery is to collect and assess evidence in relation to how the provider complies with the quality standards. And this is broken into 2 sections, the provider level and the care delivery level. The purpose of the provider level is for the collection and assessment of evidence of the provider's governance arrangements, systems and processes. And the purpose of the care delivery level is for the collection of evidence in relation to the care experience and care outcomes for older people to determine if the provider's governance arrangements, systems and processes have been embedded and consistently applied in the delivery of aged care services. And the final stage is the audit reporting. So the purpose is to clearly communicate preliminary and final audit reports with the findings of the audits including consideration of the provider's response before determining a final conformance rating against the quality standards. And now I'm just about to take you through a bit more detail in each one of those various stages. So stage 1, audit initiation. During stage 1 audit initiation, providers can expect to receive communication from the Commission to commence the audit program. And this will be through email and phone calls. So just as a reminder, please ensure the Commission has the most up-to-date contact details for your provider. You'll receive information on what to expect and how to prepare for an audit. You'll also receive a request for documents, including the completion of an audit evidence collection tool. And this form will be available on our website for you to view prior to 1 July. You'll be informed of a key contact in the Commission for support and communication throughout the entire audit program, and you'll participate in an initiation meeting to discuss the logistics of the audit program. You'll receive invitations and agendas for governing body meetings and senior management meetings. And the Commission will be transparent and provide support to providers during the initiation stage and answer any questions you have on the process. And it's a great opportunity for us to understand the context in which you're operating in. So stage 2, audit delivery at the provider level. So providers can expect the Commission to review and analyse the evidence we received from you in the audit evidence collection tool and any supporting documents you provided. We will draft an audit plan to guide the conduct of the audit activities for that particular provider. And we'll also conduct a meeting with representatives from the provider's governing body to interview them and ask questions in relation to the governance systems and processes. This usually takes about 1 to 2 hours and usually will involve 1 to 2 representatives from your governing body. Similarly, we'll also meet with the senior managers of the provider to interview them and ask questions in relation to the provider systems and processes. Topics will typically include clinical risk management, quality management, and human resources management. The Commission will determine a service sample in relation to conducting audit activities for categories 4 and 5, including any physical care delivery locations, which will be included in the audit. And for category 6 providers, it'll include an audit of all residential aged care homes. The Commission will communicate with providers the planned approach to the audits, including logistics and the sampling approach for categories 4 and 5. Next, I'll talk you through stage 2 at the care delivery level. So when we do that, we'll commence by undertaking audits at each category 6 residential care home and 1 audit using a sampling approach for categories 4 and 5. During this stage, providers can expect at each audit for you to receive a request to complete a care delivery evidence collection tool and supporting documents. The care delivery evidence collection tool will be available on the Commission's website prior to 1 July. Site-based management will participate in an opening meeting, which will usually be held virtually with the audit team to discuss the logistics of the audit and our approach to the audit, including the older people we will sample and when and how we'll be conducting the audit. At the commencement of the evidence gathering stage, we will hold an entry meeting, which is usually on site or could be virtual where appropriate for categories 4 and 5. A team of auditors will review older people files, interview older people and their supporters, interview staff and review site-specific documentation to validate how the provider's systems and processes are applied at the site. Regular daily feedback meetings will be held with representatives for the provider, and the audit team will provide progress on the audit and discuss any findings or issues that they've come across along the way. We'll then hold a closing meeting at the end of this stage of each audit, and the audit team will deliver the preliminary findings, including a preliminary conformance rating for each of the outcomes we've audited. The final stage I'll take you through is the audit reporting stage, and during that stage, you can expect to receive an email which will include the preliminary assessment report outlining conformance ratings for each outcome and supporting evidence used to determine this conformance rating. The Commission will request a response to this report from the provider, noting nothing in this report should come as a surprise to you because we will have kept you in the loop the whole way along the audit to date. The provider's response to the preliminary assessment report should include a response to any non-conformances and provide supporting documentation of any actions either already taken or planned to address those non-conformances. We usually find this currently comes in a plan for continuous improvement. Providers will receive an email with a final assessment report, noting the provider of the notifying the provider of the final findings of the audit, including any amended conformance ratings based on the provider's response. At the completion of all audits for the provider will be notified of a summary of all the audit findings and the conformance ratings, and that will conclude the audit process. The audit findings and conformance ratings will be considered by the Commission to inform the registration decision and any conditions of registration, which Sarah has taken you through previously. So now I just wanted to give you a bit of an overview in general, in summary, what you can expect from that audit process. You can expect transparency. The Commission is committed to transparency. We shared a draft of our audit methodology with providers in 2024, and we released a provider registration policy underneath the new Act in February 2025. We are continually drafting and releasing additional guidance to ensure the sector is ready for day one. During the audit, providers will know what to expect. They'll receive an invite to renew registration, be aware of the audit schedule. All evidence collection tools, meeting agendas, and other supporting material will be available on the Commission's website and will also be sent to the provider throughout the audit process at relevant times. We will collaborate. The provider's registration and renewal process emphasises collaboration and communication with providers, including when preparing and planning for audits. Providers will have a single Commission point of contact throughout the audit process that you can engage with and ask any questions. Consistency. And this is something that comes up regularly now. The Commission's provider registration process ensures a consistent approach across all providers by clearly defining roles and responsibilities and requiring the use of approved tools and templates to support uniform audit approach. It'll be evidence-based. Provider registration, renewal and variation processes adopt a systems and processes approach to identify risks and deficiencies in provider systems and processes to protect all older people receiving care. And so the outcome of being transparent, collaborative, consistent, and evidence-based is having a proportionate and fair assessment. Providers will continue to have a right of reply to the preliminary assessment report and be able to provide the Commission with assurance that they have robust and timely plans in place to resolve any non-conformance identified at audit. We're in the process as well of developing a service charter that will have expected timelines and further improve consistency and transparency. Hope you found that information helpful. I'll now hand back to my colleague, Sarah.
Thanks, Christian. I'm going to talk to you now about the forms for registration, renewal and variation, but I'm going to step through these slides reasonably quickly because I just want to make sure we've got enough time for questions. So the type and the way that providers give information to the Commission is changing. So as mentioned earlier, the forms for registration will be on the Commission's website. There'll be forms for registration, renewal, variation, revocation and suspension. So let's have a quick look at where to find, download and upload these forms. Obviously that'll be in place from the 1st of July, but we are going to try and release the forms earlier, and I think we're going to try and have them available from around mid-May. So first of all, as you can see on the screen here, you'll be able to find the relevant forms on the Commission's website. So there's the Commission's website front page, the For Providers section, and then Start an Application. So after the forms have been released, guidance will be made available for each application form to give more information on the questions in the form and the information or evidence that we're seeking. The website page will guide providers to find and download the relevant form based on a series of questions, and providers can then fill out the downloaded forms in their own time. So once complete, providers can return to the Commission's website to securely upload their completed forms and the required evidence, and the forms are then submitted for review. So you'll receive a notification that your submission was successful and we'll contact you as we progress with your submission. We're currently testing the experience of downloading, filling out and submitting the forms with a group of providers, and I deeply appreciate them doing that for us. And we're trying to make the experience as user-friendly as possible. So in the future, the self-service portal in GPMS will be updated to replace these forms for a complete online experience. So I'm just going to finish now by talking a little bit about cost recovery. So as part of the new Act coming into effect in July of this year, the Commission will introduce new arrangements for how it recovers the cost of our regulatory activity. And I'm hoping many of you saw the recent consultation paper we released about the proposed arrangements. So that consultation process has closed and we're now reviewing the feedback so that we can provide advice to government and final decisions on the arrangements can be made. What we can confidently say is that, like now, providers will contribute in some way to the cost of regulatory activities, and it's likely that these activities will be those related to entering and then continuing to be registered to operate in the aged care market. So let's just talk a little bit now about fees, waivers and exemptions associated with this. So fees are proposed to apply for 3 types of regulatory activity. So first of all, for registration, when a provider enters the market; for renewal, when ongoing registration is sought; and thirdly, any provider-initiated variations. So fees are based on the Commission resourcing required to assess those applications, and they reflect the actual cost of the work involved. So to support fairness and access, some providers may be eligible for fee waivers or reduced fees, and these waivers are currently proposed to include small providers, those in rural or remote locations, or Aboriginal community-controlled organisations. So although the public consultation closed on the 1st of April, the cost recovery consultation paper is still available on our website, and that document and the associated guide provides detailed information on the proposed fees and their implementation. And a QR code is on the slide now for you to use if you'd like to access them, and I'd encourage you to go and have a look if you haven't already at that information. Thanks, Liz.
Thanks so much, Sarah, and others on the panel. We might now go to a few questions. We've got lots of questions coming through. So I might start. We've got quite a lot of questions, Rob, which is for people who haven't seen an email but did fill out that earlier questionnaire or form that you indicated. So they're a bit confused as to why they haven't got it, but what should they do?
Thanks, Liz. I might just sort of step through that logic-wise because there's a couple of different points. If your organisation participated in last year's deeming validation survey, then the contact we should have intended to use, was the contact that was nominated in that deeming validation process. If there's been a change of staff or something like that, then it's possible that that email's gone astray. Otherwise, we would have used, in priority order, the contact point for your organisation in GPMS or the contact point in your grant funding agreement. So they're the contacts that we've tried to reach out to on the 1st and 2nd of April this year. If you're one of the organisations where we needed to go and seek consent, then we would have sent that email to either your organisation's contact in GPMS or the organisation or the contact in your grant funding agreement. If you've sent that back and you haven't heard from us yet, probably wait a couple of days. We are in the process of getting those validation, those surveys in response to the consent forms. So the preview information out in response to those consent forms as quickly as we possibly can. If you've heard that story and you can't understand where the preview email might have gone to, I'd encourage you to have a quick talk within your organisation, check whether someone else might have received it if you're not the nominated contact. Check your spam filter just in case it's got caught there. If you've done all of that and you still don't know where in your organisation the email has gone, then reach out to my team at the email address we showed you earlier, which is agecareregmodel@health.gov.au. Let us know which organisation you're representing and we'll be able to have a look at it and find out where it was sent to. And if we've had a bounce back, we'll be able to correct that with you.
Thanks so much, Rob. All right, I think the next one is probably for Sarah. When will sole traders be able to start the application process to become an aged care registered provider? And could you also share the application fees for sole traders that apply as part of Category 4 personal care? Thank you.
Okay, so that's Category 1. All right, so I'll answer this in a couple of parts, Liz, and then I'm just going to warn Rob. I might just pass to Rob at the end in case there's anything I haven't covered off. So sole traders are able to apply to be registered providers from the 1st of July. The important thing to note is that in the short term, they will also need to apply to provide care management services as well. And I'll pass to Rob to sort of explain some of those structural things in a moment. As to the fees that would apply, and I note that the person asking the question suggested they would be applying into registration Category 1. I think probably the easiest thing to do is to download the, I don't know if it'll show up because I've got the background on. This is the, this is the cost recovery consultation paper. So within that, it's got a section on fees with several tables on it, depending on which kind of activity that you're wanting to apply for. And it outlines in there the entity level assessment fee, which is once per application. And then it also has the detail for the category specific requirements. So the entity level assessment, the proposed fee there is $3,290. And the review of a category specific requirement for category 1 is $1,270. But I'd encourage you to actually go in and have a look at the document because that might make a bit more sense if you're actually able to look at that as well. Now, Rob, I might just pass over to you to add any extra comments there as well.
Yeah, thanks, Sarah. Look, I think the other thing that's really important to call out is, yes, from the 1st of July, it will be a possibility that a sole trader can apply to become a registered provider. But as a sole trader, I think have a think about when is the right time for you to take that action. And there's two reasons for that. And we've heard it with personal care. I've also heard it quite a bit with allied health professionals. So thanks for the opportunity to clarify. First message is, just because you work in one of those categories, whether it's personal care or allied health, where you could potentially register as a sole trader, as a registered provider, it doesn't mean you have to. You can continue to work in the aged care sector as an employee of an aged care provider or as a contractor to an aged care provider without having to have that registered provider status. What becoming a registered provider means is that you want to be the organisation that is going to directly receive the Commonwealth subsidy from the government and be responsible for all of the types of care that a person is receiving. And I think that's the other critical question about that judgment about when, as a sole trader, you might want to apply to become a registered provider in your own right. With Support at Home from the 1st of July, we still have a single provider model. And so that means that the registered provider that's directly receiving the government subsidy has to be able to serve all of the care needs of the people they are delivering support at home to, including care management in particular as a minimum for everyone. There is a possibility in the future that government, particularly when CHSP comes into support at home, might move towards a multi-provider model, and that would change the equation for sole providers. But that's a decision for a future government. It's not one that's been made at this point. So hopefully that gives you some context.
Thanks, Rob. Thanks, Sarah. A question here. What will happen with the application if it's submitted before 1st of July 2025 that's not been assessed by the 1st of July 2025? Sarah, I think that's you.
Yeah, no, it is. So there's provision currently in the Transitional Act for an application under the current legislative framework to become an approved provider. If that application is not finalised by the 30th of June, it then is treated as an application to become a registered provider under the new Act. So for any applications where that is the case, and we are working as hard as we possibly can to actually try and resolve as many as possible on this side of the financial year, but there inevitably will, particularly depending on when people actually apply, there inevitably will be some that will pass over. We will then engage with the applicant to gather more information. So that will be key information like which registration categories somebody wanted to actually be registered in and so on.
Thank you. The next one is, can you tell me if we need to communicate any intended service types within a registration category that we do not intend to deliver? So I think it's saying, do you have to be delivering all the types within a registration category?
Yeah, so the answer is no. I mean, obviously you have to be intending to deliver at least one. Otherwise it would make it a bit hard to meet the registration requirements. But no, as long as you're delivering one, it's fine. if you are registered into a category and you want to deliver more of the service types in that category, you don't need to come back and vary your registration. You would need to come back and tell us, though, through a change in circumstance process. And that would be the case if you were either wanting to add on an extra service type or if you were ceasing to deliver a service type as well.
Thanks, Sam. One for Christian. How will the audit report work if we have 30 aged care homes? Do we get a report for each home, or will the report be at a provider level?
Thanks, Liz, and that's a great question. So you will receive an assessment report for each of those residential aged care homes, Category 6 residential aged care homes, and then you will receive a final audit report which summarises all of those 30 homes into one kind of final summary report at the end. So one for each of the residential aged care Category 6 homes and then one at the end. Thank
you so much. The next one, I'm not sure if it's Rob or Sarah. I'll just ask the question. If a CHSP provider who is not a current approved provider registers for Categories 4 and 5 during the deeming process, does that mean they can commence providing support at home from 1st July 2025? And if not, what is the process to start being a support at home provider?
Thanks, Liz. I might have first crack at that, Sarah, and then you can jump in and correct me. So in terms of the deeming rules, that's purely about translating current state to future state. So if you're a support at home provider, common support at home provider, we'll deem you into the registration categories that match your funding agreement, and particularly the funding agreement you'll have from the 1st of July going forward. So then the question is, does that cover all the service types that you need to be that single provider under support at home? In particular, is it Categories 4 and care management? If it is, then you will need to go through the process of setting yourself up with My Aged Care as a support at home provider. You'll need to set up a service delivery branch so you can receive the payments. You need to be able to set yourself up with Services Australia for billing, but from a regulatory point of view, you'll be okay to deliver support at home. If you're not in all of those categories, then what you'll need to do first is apply to the Commission to vary your registration to add those registration categories in, or you might need to notify the Commission that you want to add a service type to give you that full mix, and then you'll have to do those other parts to set yourself up as a support at home provider.
Thanks, Rob. Sarah, did you want to add anything?
No, I was lucky that Rob took that question because I was about to pass it to him. So no, thank you.
The next one might be you, Sarah. Can more information be provided regarding who an associate provider is? Does it include a lawn mowing company and customer users under their home care package, for example? Associate provider, do you know?
Yeah, so I'll answer that, and then Rob may well correct me with the correct statutory definition. So an associate provider is essentially somebody, and I think the subcontracting arrangement is probably the one that people are mostly used to. It's an organisation who doesn't have to be a registered provider, who is delivering, a subset of a registered provider's service delivery for them. So that could be anything from a laundry service to, yes, a lawn mowing service. They're essentially somebody through that contractual arrangement is delivering services, although the registered provider, and this is the important thing, as in current state, the registered provider retains responsibility for ensuring that that associated provider is meeting all of the associated obligations or conditions as well. I'll just check with Rob if he's...
Nothing to add. That sounds good. Thanks, Sarah.
Thank you so much. All right, we might have time for a couple more. Another one for Christian. Will the current approved provider self-assessment tool be replaced with the care delivery evidence collection tool, or will there be a similar equivalent under the strengthened standards?
The tool that so the provider level tool will actually I don't know the answer to that question, Liz, and I'll take that on notice.
Okay.
My apologies.
Thank you. We've got one more quick one for Sarah. Are sample forms available to view?
Yeah, so those are the ones I'm hoping, because we've got the forms at a reasonable state of development now. We are just tracking alongside our colleagues in the department, because we've obviously still got subordinate legislation that's being finalised, and then obviously when we have government, they will sign that into law. So there may be some final tweaks to it, but we're hoping to have at least a draft version available of all the forms around mid-May for people to look at.
Thank you. All right, that brings us to the end. There's lots more questions have come in, but we will get back to people on those other matters we haven't managed to cover. I want to thank everyone for joining us today. This webinar has been recorded and it will be published in the next couple of days, and we will send you a link if you registered for this session. Finally, a reminder, the feedback survey will be available on your screen immediately after this. Until next time, thanks for joining us today.